Welcome to Med 5. The goal of our channel is to simplify medical concepts and help you understand them at lightning speed. Today, we're diving into non-zoonotic gram-negative Coccobacilli. Before we start, think about these questions. Which gram-negative Coccobacillus is a common cause of ventilator-associated pneumonia in ICUs? Which microbe frequently causes epiglottitis and otitis media in children? What bacterium is known for the paroxysmal phase of violent coughing followed by a whoop sound? More on these in a bit. What are Coccobacilli? The term refers to their shape. These germs are somewhere between being round like cocci and rod-shaped like bacilli. Their shape can make them tricky to identify in the lab. Let's break them down. First, Haemophilus influenzae. It's a small, pleomorphic species. It's non-motile oxidase positive and facultatively anaerobic. It doesn't grow on blood agar but grows well on chocolate agar, where heat-lysed red blood cells release both X and V factors that it requires. H. influenzae comes in two main forms, encapsulated and non-typable. The most well-known encapsulated strain is type B, or Hib, which used to be a major cause of meningitis, pneumonia, and epiglottitis in kids. Thanks to the Hib vaccine, those serious infections are now rare in vaccinated patients. Non-typable strains, which lack a capsule, may cause otitis media, sinusitis, and COPD exacerbations in adults. Key virulence factors include IgA protease, pili, and the polyribosyl ribitol phosphate or PRP capsule in the encapsulated types. The capsule helps evade phagocytosis. IgA protease breaks down mucosal antibodies. Pili aid in attachment to respiratory epithelium. H. influenzae illnesses present differently. Type B can cause rapid deterioration, especially in kids with incomplete vaccination. Non-typable strains lead to recurrent mucosal infections, especially in people with underlying lung disease. In the lab, Haemophilus is often grown on chocolate agar, and you can use a satellite test with Staph aureus to demonstrate X and V factor dependence. Next is Bordetella pertussis, a tiny, gram-negative, strictly aerobic Coccobacillus. It's fastidious, requiring special media to grow, like Bordetella or Regan low agar. Polymerase chain reaction, or PCR, is often used now for faster diagnosis. B. pertussis causes whooping cough, aka pertussis, a vaccine-preventable illness that may still be seen in unvaccinated children and adults with waning immunity. It makes pertussis toxin, which increases cyclic adenosine monophosphate levels in host cells, impairing immune function. It also releases tracheal cytotoxin, which damages the respiratory epithelium, as well as adenylate cyclase toxin, which disrupts phagocyte function. Pertussis has three phases. The catarrhal phase is marked by mild cold-like symptoms and is highly contagious. The paroxysmal phase features intense coughing fits with a characteristic whoop. In the convalescent phase, recovery begins, but the cough may linger for weeks. B. pertussis doesn't invade tissues deeply, but its toxin-mediated effects can cause serious illness, especially in infants. Antibiotics like macrolides are most effective early, but prevention through DTaP or Tdap vaccination is key. Next is Acinetobacter Baumannii, a non-fermenting species that's often oxidase negative and catalase positive. It's notorious in hospital settings, especially in ICUs. This germ can survive on the surfaces of ventilators, catheters, and even the floor, so it's a nightmare for infection control. It forms biofilms, resists desiccation, and rapidly acquires antibiotic resistance genes. A Baumannii causes wound and burn infections, sepsis in immunocompromised patients, and ventilator-associated pneumonia. Infections are often severe and hard to treat, especially in critically ill patients. Some strains are resistant to almost all antibiotics, necessitating last-line options like colistin or tigecycline, often in combination. On McConkey agar, Acinetobacter doesn't ferment lactose and appears as pale colonies. It's oxidase negative, so it's easier to distinguish from Pseudomonas. Let's check our questions again.
Which gram-negative Coccobacillus is a common cause of ventilator-associated pneumonia in ICUs? Answer: A. Baumannii. Which microbe frequently causes epiglottitis and otitis media in children? Answer: H. Influenzae. What bacterium is known for the paroxysmal phase of violent coughing followed by a whoop sound? Answer: B. Pertussis. Nailed all three? Great job! If this video helped enlighten you on these gram-negative bugs, hit like, share, and subscribe. Don't forget to download the summary table in the description to review the key features of each organism at a glance. Thanks for watching.